Thank you very much, Ross, and thanks everybody for joining this press briefing. I'm joined today by Professor Kate Ardern, Director of Public Health for Wigan, but the lead Public Health for Greater Manchester. And we'll hear from Kate in a moment. We thought it was important to give you the opportunity to ask questions and for us to be able to there is some variation amongst our 10 councils. So 5 have shown an increase over that week, 5 a decrease. But overall, Greater Manchester is some way below the national average. So 369 cases per 100,000 compares favourably with the national average of 440. And that's not always the position that Greater Manchester has been in during the pandemic, as you will all know from these briefings. So if we can turn to the next slide, and this is a particularly encouraging picture actually on over 60s. Again, you can see the case rate amongst over 60s having dropped throughout November, which is good news. Underneath it, you will be able to see there that 2 of our councils have recorded an increase and 2 a decrease. So we have Oldham and Manchester having recorded an increase, but the other 8 a decrease. And what we think this reflects is the success of the booster programme in Greater Manchester. And I'll come on to the figures about that later. So those are the slides, figures I should say, for the over 60s. If we could go to the age profile, not in the normal formats, I'm afraid, apologies for that. And I guess the key thing to point you to is that top line on the Greater Manchester numbers, the 65 and over band, and that shows the good news that I was just talking about, the improving case rate amongst over 65s, again, which we think reflects the success of the booster programme. Some fluctuation in the younger age ranges, again, probably linked to half term, etc. But the good news there is the over 65s. If we can move on, and developing the theme that I've started, these are better figures for situation in care homes over the month, and again, we think that is reflective of the booster programme and that taking effect, which is good news. And continuing in that vein, you will see the hospital numbers reflecting a similar picture of improvement over the month, marginal in terms of critical care. So 55 patients a couple of weeks ago, down to 48 on the last count, and overall a reduction in the numbers of people in hospital beds. Although we always have to balance these figures now with the the other pressures on our hospital system, which are considerable, to say the least. But a slight easing of pressure from a COVID perspective in our hospital system over the last couple of weeks, over the last fortnight. And if we could go on then to the final slide. So this is a more complete picture than we've shown you before on vaccination progress, and particularly the final column is the first time we've presented the figures on the booster programme for you. So that is a pretty encouraging figure, I have to say, with regard to over 70s, with 80%, 4/5 of people having had their booster jab, and we think that is pretty close to the national average. There or thereabouts. Obviously, really important now to get the message out to the 50 to 69 age group, many of whom will now be able to come forward as of now because of the changes that the government has announced with regard to the booster programme. I think what we can say today is it is clearly working. It is clearly protecting people. So please take up that opportunity as soon as you possibly can, because it's possible that we are in a moment here where we can have a big impact given the case numbers in Greater Manchester. The more that we take this moment to encourage people to get their boosters, we can do more to protect ourselves than perhaps other places can from what may be about to come with Omicron. The figure on 18 to 49s, only 8% having had their booster. If we could just flick back to that. I don't know if we've lost the slides. Thank you, Alex. So the slide at the number at the final column, third line, 8% looks low, but that does reflect the fact that until now, many people in that age group haven't been eligible to go forward for their booster, but the changes announced will allow people to do that. So we would strongly encourage people to go ahead and get their booster. Equally, we would ask people in the middle column who've not yet had their second dose to do that. It's very important that people do. But the figures today, we think, reflect the success of the booster programme. So thank you. Those are the slides. Just a couple of other points that are important. You may have picked up today that Bolton Council is aware of 2 highly probable cases of COVID-19 with mutations consistent with the Omicron variant. So they have confirmed, well, they've said that today. These cases, I must stress, have not been laboratory confirmed, but obviously the council saying that it's highly probable. And most likely linked to international travel. So what I thought I would do at this moment, given obviously this is the first time that we've had probable cases in Greater Manchester, I thought I would bring in Professor Kate Ardern to explain how this is being handled by our colleagues in Bolton, but also by directors of public health across Greater Manchester. So Kate, over to you.
Thank you, Andy, and good afternoon, everybody. I think Omicron is and 9 of those are in Scotland, the rest are in England presently. We've had our first confirmed case of Omicron in Liverpool. That was confirmed today. And as the Mayor said, we've got 2 highly probable cases of Omicron being investigated currently in Bolton. But I am also aware of other highly probable and possible cases being investigated across the Northwest and also across other regions. And I think it's important at this stage to say that Omicron is certainly has been identified in a number of regions across England. So London, the South East, East Midlands and East of England, as well as now the Northwest. Our colleagues in Bolton, and this is how directors of public health are responding to Omicron, have gone in, retested the individuals concerned and their households. Their contact tracing, enhanced contact tracing is underway. This is very much the bread and butter of public health. And of course, those cases and their contacts are now self-isolating. And it's important to stress that with Omicron, all contacts have to self-isolate regardless of vaccination status because of the nature of this new variant. So very swift and rapid action to try and contain these cases, but also to get the kind of testing material we need to look at how Omicron is spreading in the UK, and to help us understand what other measures we need to take to tackle it. And very importantly, of course, the government have now brought in additional measures, particularly around mandatory face coverings. And again, it's reinforcing those messages of wearing your face coverings, where it's mandatory, of course, but also be sensible and wear them in enclosed public places. Observe the hands, face space, ventilate, and of course, really importantly now, continue with regular lateral flow testing twice a week, and of course, if you're deciding to go out and socialise.
Thanks very much indeed, Kate. And I'll just then quickly pick up a few other issues before we hand back to Ross and open up to your questions. So firstly, on face coverings and the new requirements to wear them on public transport and in shops. The early indications from the Metrolink system are that between 60 and 90% of passengers are wearing face coverings, and now that depends on the line because there's variation across different lines, and also on the time of day. But there has been a noticeable increase in levels of face covering wearing, and this is up definitely from where it was in weeks preceding the change, where it had got to around 1 in 3 people wearing a face covering. So thank you to everybody who's obviously responded to the news. I would say I think the figures reflect some of the concerns we've raised throughout this year, particularly when the requirement was relaxed in the summer, that it would be hard to get the level back up to where we need it, should we have to do that. And obviously, as we predicted, we have had to move back to a requirement on face coverings on all modes of public transport. So we will be working with colleagues in Metrolink, but also Greater Manchester Police over coming days to lift the compliance with the new requirements up to where it needs to be. There will be an increased presence on the public transport system, particularly at weekends, and they will be using the encourage first, educate, but then enforce approach, and there will be enforcement should that be needed. So that is the latest position with regard to face coverings. One issue that has been raised by our SCG, our strategic group across Greater Manchester, is the need for self-isolation support. Kate mentioned the probable cases we have, but also the possibility that there are other cases around. We want to be able to ensure that people can self-isolate if they need to do so. And there's a call come from our councils on the government to ensure that there is funding in the discretionary support system that councils had to be able to facilitate that self-isolation should it be needed. So in many ways back to some of those issues that we were grappling with earlier this year and last year, but the call has come through at the Greater Manchester level for adequate support to be provided to ensure that people who have a case or are suspected to have a case are able to self-isolate. I'll just make a final point before I finish around hospitality, because Kate touched on it. Following some statements made by I think principally the Deputy Chief Medical Officer around socialising, there is a concern in the hospitality industry that already there's been an impact on bookings for Christmas parties and events, also an impact on hotel reservations. And I think it's important that we we put a view out from our perspective as to this, so that we don't get back again to where we were last year and the industry struggling as we know. But from our perspective, we don't believe, given the current evidence, although we stress it may change as we learn more about Omicron, but we don't believe at this stage there is a need for people to overreact. Of course, people should get in the habit of taking regular lateral flow tests, but if the right measures are taken and people are careful, there is no reason to cancel events or cancel bookings, and we would encourage people not to do that, as long as they are also taking those necessary precautions. Of course, it's a matter of choice. We understand that, but we also want to obviously ensure that we help our hospitality industry recover after a very difficult 18 months. And already the signs are that there has been an impact following recent announcements. So more broadly, just to finish, we would say, the wearing of face coverings on public transport and in shops, getting back in the habit of some of those sensible things that we were all used to doing earlier this year and last, around distancing and hand washing and sanitizing. It's just sensible stuff to do at this moment in time, given where we are and given the likely spread of Omicron from the position that we're in today. We think taking those precautions will actually protect the Christmas period and people's ability to socialise and have a more normal Christmas than perhaps we were able to do last year. So certainly from our perspective, there's no sense of overreacting to what's happening. As I said before, the figures from Greater Manchester's perspective have moved in the right direction in recent weeks. However, we are now in a new position with the arrival of Omicron. We are being cautious. It's why we wanted to give you this briefing today, and it's why I'll hand back to Ross now, so that you can put any direct questions to either myself or Kate to get the extra information you need. So thanks very much.
Thanks very much, Andy. If colleagues in the media could indicate if they want to ask a question by using the raise hand function now, and I'll just give you a moment or so to raise your hands. Once we do that, we'll be able to open your camera and open your microphone. And if you just say who you are and where you're from, that'd be fantastic. I'm going to go to Jackie McDonald. Jackie, you should be able to turn on your camera and microphone now if you just say who you are and where you're from. Thank you.
Hi, Jackie McDonald from Global Radio. Andy, you mentioned being sensible and doing all those things that we've been doing over the past 18 months, but is there a danger that people might get fatigued by this now and they will see that level of compliance drop?
So I think there is a danger of that, Jackie, and we're all feeling that fatigue in one way or another. But I said this at the weekend when the government announced its change on face coverings. We've got to remember these are reasonably small things that people can do, and people know how to do them because of the experience that we've had because of the pandemic. And by doing those things, it's the best way we can prevent something even less palatable coming down the line. So more restrictions, or God forbid, the idea of a lockdown, which I think people would feel, incredibly kind of difficult to take. And my sense is, if we go at vaccination in the right way, if people go now and get either their first jab, their second jab, or their booster, that is definitely the best way to prevent something that is far worse. And I would just really encourage people to go and do that. The vaccination program is clearly working. It's working well. It's our best line of defence against all of this. And I just would encourage people to go and do that. Then the other measures are, I think, modest in the great scheme of things. Nobody particularly likes wearing a face covering, but there is evidence that it does slow the spread of the virus. And all of that is obviously there to then stop us ending up in a position like we were last year. Nobody wants to be there, and I actually don't think we will be there, but it is linked to the extent to which people take on board the less onerous things now, so that we can prevent something worse later down the line. So, you know, it's just an appeal to people to say, look, it's not like these things aren't working. You know, the vaccination program is clearly having the effect that we want it to have. The more that we can get those numbers up, you know, towards 85% coverage on the booster program across the age range, then we'll be in a really strong position as we get into the more difficult parts of the winter period. And I just think on face coverings, you know, apart from anything else, it's, you know, it's a mark of respect to NHS staff, I think, that people are conscious that, you know, they are under massive pressure at the moment. Anything that we can do to relieve pressure on our paramedics, our ambulance staff, our A&E staff, more broadly our NHS staff, we should be doing, because if you go into the system at the moment, you speak to people there, you know, they are continuing to have the toughest of times. And I just think it's just about being a decent, caring sort of citizen, isn't it? In saying, well, anything I can do to take pressure off them, I should be doing at this moment in time.
Thanks, Kate.
It's also worth saying, Jackie, that in addition to that, we need to use the public health measures. We've got those very simple measures to buy us some time to make sure we are able to tweak the vaccine to meet the challenge of Omicron. So that's really important. Those measures cut down transmission. The more we can actually reduce transmission, we can slow the spread of the rate at which Omicron spreads, and that's really important. And these measures, hands, face, space, ventilate, also protect us against other seasonal viruses. And don't forget, we're just coming into the flu season, and that will really take off in the next 2 to 3 weeks. So those hands, face, space, ventilate really, really help protect us against flu and respiratory syncytial virus, both of which provide significant challenges to the health and care system alongside COVID.
Thank you.
Thanks, Jackie. I'm going to go to Tom Dambach. Tom, you should be able to switch your microphone and camera on now. If you just say where you're from and your question.
Yeah, Tom from Hits Radio. Just first of all, it's been reported, hasn't it, that there's a few vaccination centres that have closed since that sort of initial vaccine rollout. I just wondered whether we can expect to see more pop-ups happening as this booster programme widens, and when people could expect that. And I think this has been touched on, but just secondly, how difficult, how crucial is this next 3 weeks, next 4 weeks, based off past experience as we wait to find out more about this particular variant?
I'll let Kate come back on the first part, Tom, about the you know, the capacity of the vaccination centres and the programme more broadly. I mean, on the second part of your question, I think, as I said at the start, we're in a position that we've not always been in here, which is we're kind of behind where the rest of the country is at the moment with regard to the spread of cases. So some way behind, actually, if you look at the national average and the Greater Manchester average at the moment. So we've got, you know, I guess a little bit of time, only a little bit, to protect ourselves from what might be coming. We don't know, do we, how Omicron is going to spread from here. What we do know is that the booster program is successful. So, and we also know that people can have a booster that this time last week couldn't have a booster. They can go forward right now and get that protection. So it just is clear that that's the right thing to do. You know, to if you've not had your first jab, go and get your first jab. If you've not had your second, go and get it. But particularly if you are eligible for your booster, and not everybody is at the moment, but if you are, then please go forward and get it. And then Greater Manchester will be in a much stronger position to face the winter, but also to hopefully have a much better Christmas here than the one that we had last year. It wasn't particularly good, was it? Let's remember December in Greater Manchester last year. All of our kind of hospitality was closed, and it wasn't what we wanted, and we're in a position where we can change the course of events. This is the key point, isn't it? We have the ability to be more masters of our own destiny this year than we did last year. So please, let's take advantage of that. Wear face coverings on public transport, in shops, as people are required to do. Kind of get back to observing distancing, use the sanitizer, but then, wherever you're up to with your vaccination journey, go and have your next step if you've not had it, because then, we'll all be together in a much stronger position to face the rest of this month. And that is somewhere I don't think we've ever been really in that position at any point in the 20 or so months of the pandemic. So let's keep this upper hand over the virus and not let ourselves drop our defences at this particular moment in time. But Kate, could I ask you just to pick up the point about capacity of the vaccination system?
Yes, thanks, Tom. A really good question. And yes, my colleagues across the NHS are looking at capacity in terms of things like pop-up clinics, obviously the strengths of our local primary care systems, and we've been doing, for example, very successful in my own borough, we've been utilising our leisure centres to do mass vaccination, which of course are highly accessible to the public and very popular. So the big push obviously is on getting the booster programme. The other, I think, very helpful thing that the CMO is working through with the Medicines and Healthcare Regulatory Authority, at the moment you have to wait 15 minutes after you've had your Pfizer jab, for example, and whether that's really necessary. So that would obviously help timings and throughput. So there's a range of activity going on, looking at pop-ups, looking at extra staff who we can bring it on site. For example, we can utilise some of our excellent staff, volunteer staff and student staff to help man vaccination centres. So it's really all hands to the pump at the moment, and making sure that we can sort of deliver vaccines at times and places that are accessible to people. So, for example, we learnt a lot of lessons around delivering vaccines to older people. They prefer appointments early in the morning, sort of morning appointments, whereas younger population prefer it evenings and weekends. So it's being really flexible about opening times. I think obviously the announcements from Amanda Pritchard around extra payments to primary care in terms of staff, the use of our pharmacists and community pharmacies are brilliant at delivering vaccination programs. They do flu as well as COVID. So yeah, it's having as many multiple channels of delivery for the vaccine, making sure it's flexible and accessible in terms of transport and location, and of course timing. So clearly, my message to the public is keep looking at your CCG website, looking at the NHS website for your local vaccination centres, and make sure you just get on and book your vaccine in at a convenient time and place for you. Thank you.
Thanks, Kate. I'm going to go to Andrew Knoll. Andrew, you should be able to switch your camera and microphone on now if you just say where you're from and your question.
Hi, yeah, thank you. It's Andrew Knoll from Manchester World. So a question about the booster program and the rollout, where the sort of age groups where some people haven't come forward. I was just wondering, has any work been done on understanding perhaps why people haven't been coming forward yet, and if so, is there any programs to tackle that, perhaps similar to the ones that were done previously for vaccine hesitation in the first place? I know there was a lot of engagement done with different communities about, are we looking at the same thing for the booster to try and see why the numbers aren't up and what can be done? And possibly a very quick one, if I could just squeeze a second thing in, what's the very latest understanding that we've got scientifically on Omicron's transmissibility and seriousness and how ill people become? Thank you.
I'll certainly leave the second part of that question to Kate. I will be well out of my zone of expertise if I try to answer that, Andrew, so forgive me if I won't. Just on the first bit of your question, though, again, I'm going to come back to what I said at the start, which is those figures for the over 60s, I think they do reflect the success of the booster programme, and they are clear evidence of that in Greater Manchester. And I would therefore point people towards that evidence today as the reason why people should go and get their booster. I mean, I can imagine some people have been thinking, I'm double vaccinated, do I really need to bother with this? I think if you look at how different the case rate is for the over 60s compared to younger age groups, I think you've got your answer there. Yes, it makes a real difference. And bear in mind, it's obviously a different vaccine that you get for your booster, you know, to maximise the coverage. So if you've had AstraZeneca, as I understand it, you get a Pfizer booster, you know, you are putting yourself in the strongest possible position with all of the uncertainties of the winter that lie ahead of us. I think just the other thing to say before Kate comes in is obviously the figures, I think, reflect the fact that some people haven't been able to come forward until this week, and the changes that the government has just announced, and they are very welcome changes, actually. So, you know, for instance, you know, for my own case, I wasn't eligible until this week because of the timing of my second jab, but I am now. So, you know, obviously I'm making those arrangements. So it's I think reflective of that as well, eligibility. But you know, certainly 80% in the over 70s is not bad at all. But I would say to the 20% of people who haven't, you know, really they should. Or I think it's slightly less, isn't it, given the overall numbers that have had the first two jabs. You know, ahead of the winter, it has got to make sense. You know, if you know your mum or dad hasn't had that booster, you know, go and help them ensure that they get it, because it's got to be the right thing to do given the figures that I've just presented today. But Kate, did you want to pick up the second part of Andrew's question?
Yeah, I'll just also follow on a little bit from your theme as well, Andy. I think, Andrew, the thing that more concerns me rather than the booster, and I think, you know, the Mayor's really explained why we have differences in the age group. It's about eligibility, and like him, I've only just become eligible for my booster as well because of the change from 6 to 3 months, and I think that's really welcome. But I think it's also important that to say to people, if you haven't completed your primary course, your first and second dose of vaccine, you know, no one's going to tell you off. Please book it and please come forward, because that's the group we're really, really worried about. The group that actually haven't completed a primary vaccination course at the moment. You know, you are not protected, and obviously with Omicron having arisen, you are more at risk if you are not vaccinated. So please come forward, get your complete your primary course, as well as obviously encouraging people to come and get the booster. Now, in answer to your second question, obviously evidence is still emerging, but what we seem to be seeing with Omicron is it appears to be more transmissible than Delta, and it appears to have a higher reinfection rate. So it has some ability to reinfect people who have acquired immunity, either by infection or indeed by vaccination. So that's one of the reasons the vaccine manufacturers are obviously looking to tweak the formulation of the existing vaccines, bearing in mind that they were developed to combat alpha, beta and delta variants. This is no different, by the way, to what we do with the seasonal flu vaccine. You know, we tweak it every year to meet the circulating strains that are around. However, it's very important to emphasise to people that the present vaccines do protect against the serious consequences of COVID infection, whichever variant you're talking about. So there is still good protection from the existing vaccines against Omicron in terms of serious consequences. At the moment, we're not seeing any evidence of it being more virulent than the old variants, but obviously it's very early days yet, and that's something that's being monitored, particularly in the countries where Omicron is much more prevalent now. In terms of what's likely to happen, it's difficult to say, but clearly we have to plan for Omicron potentially displacing and overtaking Delta variant. Now it's here, and it clearly is more transmissible, and that transmissibility that's why the measures we've put in place and are advising around hand space, ventilate, doing your regular lateral flow testing is really, really important. It buys us that time and space to continue with the vaccine rollout, for the vaccine manufacturers to decide whether they need to do any tweaking to the existing formula or not, and to get as many people with significant protection against COVID infection going into the winter. So that's what's really important, because it does appear to be rather more transmissible than a Delta variant. So I think what we're likely to see is now it's obviously in the UK, it's starting to displace Delta variant, and that may be why you're starting to see, for example, the R number rise in London and the South East to higher rates than it's been before.
Thanks, Kate. I'm going to go to Helena Vesti. Helena, you should be able to turn your mic and camera on now. I think this will be the last question, because we do have quite a hard deadline of 4 to finish this today. Helena, if you want to switch your mic on. Are you managing? You should be able to switch both your camera and your microphone off. I've just double checked, and that's been opened for you. I think Helena's having a wee issue, so if we just give it 2 seconds. Right, Helena, you should be able to open up your microphone now. Nope. I think we might have to ask if anyone else from the MEN is able to maybe take Helena's spot. Yep, so I'm going to go to Jen. You should be able to unmute yourself and ask a question now, Jen.
Hello, can you hear me?
Yes, we can.
Okay,
Yeah,
just give me 1 second to figure out exactly what it is that we were going to be asking, because I think some of what we had talked about has probably been covered. Okay, so one for Kate. I wondered if you could give us an insight into how fast you think the variant is spreading. I know you talked about the cases that we have already identified in Bolton, and that sorry, let me just shut my bloody phone up, sorry, and possible other cases of it. But I wondered if you could, if there's any sense yet about how fast that spread is happening, and also what the implications would be for the vaccine programme, and whether the NHS will be able to kind of cope with that increase. And I think I would just add to that as well: has the NHS got the capacity to actually roll out the vaccine under the kind of accelerated booster programme that the government is talking about? And one in relation to schools, and I think this is kind of for both of you. It looks like schools are all doing different things. So some of them have cancelled activities, some are just telling people to wear masks. Secondary schools have got clear rules, but primary schools less so. What's your guidance where schools are concerned? Thank you.
Do you want me to kick off on that one, Andy?
Yeah, I think they're for you. I think, Kate.
Okay,
so,
thank you. Thanks, Jen. I'll sort of take them in reverse order, if I may. Our school cell across Greater Manchester has produced some really excellent guidance on managing COVID in schools. Now, this has to be taken into account, Jen, within the context of each school. So we've local public health teams have worked with schools. We've done individual risk assessments for each school, because each school setting is different. We actually brought in face coverings in communal areas for all students, staff and visitors in our high school ahead of the government change to the rules. So we've had those in place for 2 or 3 weeks now, and we'd already made a decision to keep that in place till the end of term. So we were sort of almost ahead of the government changes there. And the DfE rules have changed to give Directors of Public Health a bit more shall we say, leeway in managing outbreaks within schools. So the school setting, you know, we are working very closely with our head teachers. We're making sure that they're undertaking risk assessments for all of their activities and working with them. So it may feel as though it's a little bit different, but that really depends very much on the individual school circumstances. But everyone is working within that really, I think, very comprehensive Greater Manchester Schools framework, which, by the way, our Regional Schools Commissioner has commended to other parts of her region to adopt, because it's a very comprehensive approach to managing outbreaks in schools. And indeed, I've started to see, since we introduced that, a reduction in school-based outbreaks. So I think that's really welcome. In terms of, you know, the actual how fast Omicron will spread, I think it's a little difficult to tell at the moment. But I guess that I would say just, you know, we'd only really heard about Omicron last week, and suddenly we've got 22 cases. It's clearly, you know, come into the country around mid-November. We're starting to see that spreading, and it's quite a diffuse geographical spread, you know. So we've had cases in parts of London, in East Midlands, in Nottingham, for example, in Essex, but also in Scotland, and now obviously also in the northwest. So that's quite a quick spread. So I guess that's what's really sort of prompted the measures to come back in place, because it seems to be spreading really quite quickly. So that shows it's a transmissible, highly transmissible virus. And I guess we will need to see over the next week how how many more cases we start to identify. What's also happened is that all positive PCR tests that go through the UXA laboratories, what we call the Pillar 1 route, they're all being genomic sequenced. So we should get a real sort of sense of how quickly Omicron is spreading. We also have wastewater testing as well, which may sound a little bit geeky, but we actually test through and wastewater for genomic sequencing as well. And that will also, I think, help to determine how quickly it's spreading. But it does feel as though it is starting to spread quite rapidly. And I guess that's, in keeping with what we've seen in South Africa and elsewhere, where it does seem to have quite rapidly displaced Delta. So I guess that's what we're going to be watching and actively monitoring over the next few weeks. In terms of NHS capacity around vaccination, I think it is a real challenge for my NHS colleagues with everything else that's going on. But clearly the vaccination programme, and Amanda Pritchard was very clear on the Downing Street press conference that the vaccination programme is an absolute priority. So it will be a case of all hands to the deck to get it rolled out and get the booster programme rolled out as quickly as possible. And obviously, me and my colleagues in local government will do everything we can to assist with that, as we do a lot of the volunteering around vaccination centres. And
I think there's been a wee issue there, Kate, with your sound. Kate, I think there's been an issue with your sound. So if you were just finished there, we might want to hand over to Andy, just because I'm conscious of the time.
Okay, thank you.
Thanks, Ross. I don't think there's a great deal more to say. I mean, Kate covered all of the important points there in answer to Jen's question, the MEN question. I just thank everybody for joining. Obviously, we're not in a moment where we know everything about the new variant and what it means. But I think there is some encouraging news today that we're in a stronger position than we've been in previous times. And hence we've got more ability to protect ourselves from the uncertainties that lie ahead. So thanks for coming, everybody, and for your questions. I hope you found it helpful to have this briefing today. And obviously, we will be keeping a very close watch on things as they develop over the coming days and weeks, and we will keep you fully informed. So thank you, everybody, for joining. Thank you to Ross for sharing things, and we will see you all next time.
Thanks all.
Thank you.